Does charting in medicine seem overwhelming? The queue of messages, labs, patient calls that never seems to get smaller? The pile of pre-authorizations awaiting your input? The tens or hundreds of charts that you still have to finish and sign? It's exhausting, right? And still, all you want is to be able to go home with your work done, to be able to spend time with family, hang out with friends, practice self-care. I want to invite you to join me for a 6-week-long coaching program, Charting Mastery, where you will get equipped with the skills and approach that you need to get home sooner and leave that work at work. To check out more info and to join the waitlist, head over to chartingmastery.net. You will be among the first to hear when the doors open so that you can join me on this journey. There will be opportunities to reflect and earn CME after the different sessions as well. And now on to today's show. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stejink, general pediatrician and life coach for physicians. Welcome to another episode of the MedEdWell podcast. Thank you so much for joining me, for listening, for sharing, and for really engaging as we each try and take that next step in our wellness. Today on the podcast, I'd like to welcome Dr. Evka Cesnek, a family physician, medical doctor, online course creator, best-selling author, and podcast host. She is a thought leader on topics with which she has had both personal and professional experience. She does worldwide consults on food allergies, pediatric feeding challenges, and babies with colic. Her goal is to empower young parents with a sense of control and strategy that removes some of the overwhelm. Welcome to the show.
Yay! Well, it's such an honor to be on your show. Thank you very much for having me. I know you in non-podcast, non-video world as well, and you're such a important person in the field of pediatrics and children and helping as physicians share their journeys. It's an honor to be on your podcast. Thank you.
Well, thanks so much for joining me. Tell me a little bit about your journey through the medical system and through training and how maybe you've seen wellness and certain challenges come up for you.
Oh, absolutely. Gosh. So I actually am an immigrant to this country. So we escaped communism when I was young, and we lived for a little bit in a refugee camp in Italy after crossing the mountains in the middle of the night into freedom. Which was fun. And refugee camp was kind of hard too. And then eventually we won a lottery system that allowed us to come here to the United States. And I was young, I was a child at the time, and we settled in New Jersey, and my mom cleaned houses, and my parents always told me to work hard and to study hard and to try and make a name for myself or to do something, because now we're here in this land of opportunity. We're in the United States. And so we have to take advantage of that, because look how much we had to sacrifice just to be able to get here. And so we have to take advantage of that. And the motto always is, and I probably see this in a lot of immigrant families, you work hard, you study hard, you work hard, you study hard, you find a dream and you go after that dream. And for me, that dream took me into wanting to be a physician and wanting to go into medicine, because if you look at it, like, there's people who get really sick, and illness doesn't discriminate. It doesn't matter if you are somebody who makes $7 an hour or if you're somebody who makes millions. illness doesn't discriminate. And lots of people, regardless of how much money they have, would give a lot just to be able to be healthy or for their children to be healthy. And so health is incredibly important to us, no matter who we are. And what a great privilege it is to be able to help people with their health. And what a great privilege it is to be able to hear stories from people, regardless of who they are, about their lives, about their health. And then you can go ahead and you can help them. So I went to medical school in New Jersey and did a combined program with MD, MPH. So I also got a master's in epidemiology and biostatistics. And from there, I went into a family medicine program. And I like family medicine just because when you're doing family medicine, you see everybody, you get the full spectrum. You can help deliver babies, you get to see the babies that you get to, as you spend more time in one office setting, then you get to see those babies grow up. You get to see parents, grandparents, and so you get the whole spectrum and you can help people. And with family medicine, you can learn a little about a lot of things, or you can really focus down on one thing. And when I finished my residency program, I worked a lot. So I did 3 jobs at one point. I did house calls. I did helped run an urgent care center, and also saw patients in the office. But nothing prepared me for the journey that I had with trying to help patients and help change medicine once my child was born.
That's really,
Go ahead.
yeah, I was just going to say that's really inspiring. Thanks for sharing about your journey. Yeah, just through life and through medical school, and then bringing all of that. And I think that's one of the really encouraging parts about just the humanity, the humanism in medicine, of like connecting with other humans and their story and saying, yeah, I've had this experience and that's how I'm able to, yeah, just connect with you as a human being, because I have my own story and you have yours. And this is how they intersect in this moment when you're just caring about helping them with their health. So tell me a little bit more about.
What you say to patients can matter. It can make a big difference. And so if you approach them with love and you approach them with understanding and acceptance, and you really listen to them, you can make a big impact in their lives, not just with necessarily diagnosing them, but also like just saying, I understand where you're coming from. I get you. I understand what this journey is like, and here's what I can do to kind of help you to make your life a little bit easier. So, and I noticed that, like, I noticed myself, like, really understanding what people were going through when I had my own challenges in my life. And then I had to figure out a way to turn those challenges into a way to not just help myself, but also help other people. So I wanted to tell you a little bit about my journey as a parent through the medical system, because when I worked a lot, I enjoyed medicine, didn't really feel burnt out, even though I was working a ton of hours. It was my calling. It's what I wanted to do. And it was supposed to be a really joyous time in my life because I had the birth of my baby, my precious, loving baby. It was supposed to be full of light and joy. And I so wanted her so, so much. And when she was born, she had challenges that, like, I heard my patients talk about a little bit, but not to the extent that I experienced them as a mom who's caring for your child a lot. So my daughter cried and cried and cried and cried. She had what I would describe as a pretty severe case of colic, but she also vomited a lot. She also had a lot of feeding challenges. She would turn away from the breast. She would turn away from the bottle. If she sucked, the sucking would take a long time. And she was dropping percentiles on the weight curve, and I was worried. about what was going on with her because of the challenges that we had, and the vomiting and the changes in stools. And it's hard to forget those things, those moments in your life when you face challenges like that. They stay with you, and they stay with you for a long time. And then you have to create meaning out of them because you have these challenges. And, like, well, what do you do? How do you proceed with your life as a physician, making those hard moments in your life, whole own life, count? And how can they be used to help others? And going through the medical system as a physician, the other thing that kind of happens to you, especially if you're somebody who's had seen children, and I saw children for like a decade, you understand how much of the medical system we don't know yet, or how much of medicine we don't know yet. You come face to face with the boundaries of modern medicine and realize how much there is still to know about certain topics. And as a parent, when you're dealing with significant concerns in your child, like the ability to feed, because feeding equals living, right? It's really important. And you come to the boundaries of what we think we understand in medicine. Like, what do you do? Because it's stressful.
I was just going to say, yeah, how was that navigating both working with specialists to care for your child and yet knowing that there were boundaries and maybe knowing that it's like, okay, this isn't normal for my child to be doing this. How did you reconcile all that? Or did you feel like you had different challenges navigating the medical system being a physician parent?
I think so. I think, and there's a whole bunch of ways that manifests itself. One way is, like, do you even mention that you're a physician to the doctors? And at one point, I finally did, and I said, let me be a physician, because how will they treat you differently? What else will happen? The second thing is that you get bounced a lot from specialist to specialist. So your child that is dropping off the weight curve, they're having significant challenges feeding. They're taking a really long time to suck. They are getting to the point where they're only feeding in their sleep. There's conversations about things like feeding tubes. And so this is outside of what you might normally see in a family medicine office or in a pediatrician's office. So then you go to the specialist, because that's what they send you to. They send you to the specialist. And the specialist may be, appointments far away, because everybody wants to see the specialist. But eventually you make them, right? You eventually get to the specialist, or you might have to get up at like 4 a.m. to, like, for us, to drive all the way in New York City to be able to see a specialist. And you get there and you ask them questions because you're thinking this through and you're reading the medical literature and you're like, what can I help? Like, what's going on? How can we get answers for my child? And I want those answers right away. I want my daughter to start feeding and feeling better and no longer vomiting, having all these symptoms, like, right away. And you go and you ask them questions, and they were like, well, we don't know, or there isn't testing, or we just haven't encountered this before, or this is unusual. Let me send you to another specialist. And then you make another appointment and you go see another specialist. And that specialist may do the same thing to you again and say, well, this isn't quite what we normally deal with either, or it's not something that, they give you some answers, but as a parent, you have anxiety, you have worry, and you want things to be better. And some, like feeding, for instance, feeding challenges can take a long time to improve. It might not be overnight. And so you want answers. You might not get them. You might be sent from specialist to specialist. And then you start to figure out that there's certain fields of medicine where I feel like there should be a subspecialty and there isn't. Like, for instance, the field of pediatric feeding disorders. I think there's a lot of children who really have significant feeding challenges. There should be pediatricians or family physicians that that's what their focus is because there's so much to it and they don't really exist, right? It's not exactly pediatric gastroenterology, it's not exactly pediatric allergy.
Hmm. So how did that experience of bouncing back and forth between all these specialists, how did that affect your own clinical practice and how you approached your own patients?
Oh, lots of to discuss there. First of all, I think because I have been working so much and because I had spent like 12 years of my life trying to become a physician, right? All the training and especially the MD and PH, like, and you do the residencies 12 years and you work so hard just working on becoming a physician that becomes such a large part of your identity. And then you wind up in a situation where your child needs you. And at one point, had to go to feeding therapists, or we had to see specialists. And this can take up a significant amount of your time. So we were doing feeding therapy most days of the week, trying to help with the situation. And it required so much of my own time because there was nobody else who was willing to do the parenting thing for me. Like I had to do it, right? And so I let go of certain jobs. I let go of my job as in urgent care. I let go of my family medicine job, and I just focused on house calls so that I could get more time to do this. But then I realized like that yes, maybe what working on right now has changed, but look what else I can do. Maybe this difficulty can turn into an opportunity. So I went and I got trained in various modes of feeding therapy, for instance, and started learning how to do it, not just to be able to use it on my own child, but also to be able to help other families with it. So I got extra training, and it's really cool when you are a physician. There are training programs that are available to you that might not be available to the average parent, but just because you have a medical background, you have a physician, they let you into those programs. So that was really good. And then I realized that if there's a field like I feel like should exist, like this pediatric feeding disorders field, why not start writing the books to make it a reality? Why not start writing the books to help other families going through the thing that you're going through, right? But start small. So my first book was my daughter wound up being diagnosed with FPIES, or type of non-IgE mediated food allergy. And when she was diagnosed, like the diagnosis code was there, but the guidelines of how to treat it didn't exist yet because it was considered a new entity. So, like, what do? You read the literature, you figure it out, and then you write the book, and the book helps you and it helps other families. Or colic, right? So, my baby cried and cried and cried and cried. What is there that we need to know about colic? So, right now, I just have a 300-page book that's out there about colic. I went through all the literature and I thought about my own experience treating patients with colic in the office as a physician who's been working for a decade. So, writing books about that. And there's another book that's coming out about pediatric feeding disorders and how to treat children who really have challenges with feeding and their babies.
Wow, that's amazing just to say how you took this really hard season in caring for your child and then said, "Hey, I'm a physician. I can learn new things. I can apply and pivot and then be able to write these books and to be able to say, no, I'm still helping patients and families. And it may just look a little bit different in this season of your career, but it's, it seems like you are just so passionate about it. It's really inspiring."
Thank you so much. It's realizing that there's areas of medicine that still need work. And I think you realize it more when you're the parent who's going through it. When you are dealing with it, you have that medical background and you know where the boundaries of what we're able to offer people are, then you can think, well, what else do they need to know and how can I help? And then you can take what you learned through other training programs, like a speech language pathologist, for instance, might, or some occupational therapists might take feeding training programs specifically for children. Well, I can take those too, and I have a different perspective on that than they do, just because of my medical background, and then use that to not only help myself but help other families, so that in the future, other families who are going through something similar don't have to have as much of a struggle. Because that's how things happen. We figure out where the changes need to be made, and then we go ahead as physicians, because we have a duty to society to help, right, and to help figure it out.
Hmm. Well, that's why so many of us went into medicine, was to help people. And so, yeah, saying there's the ways we've classically been taught in those categories for helping. But yeah, there's so much more when it's, oh, my child has this and they need this, this, and this. And it's not the same as classical presentation of it. It's like, oh, if the specialist thinks that it's unusual, that's usually, yeah, pushing boundaries that haven't been explored before. And it doesn't mean that it's not real or that it's not treatable. It's just saying we are still learning about it. And I think it takes people with that curiosity and that drive to learn to push those boundaries that'll really help us continue to move forward.
This families dealing with conditions that worry them about their children, who they care about so much, often are the ones who are at the forefront of helping to make the changes that help propel medicine forward. Progeria, right? Progeria. They now have where you age at a really accelerated rate, and a lot of these children died young because they age so quickly. It was the work of physicians who had a child with it that helped to propel that condition forward. They helped with the discovery of the gene for that condition. And then they also helped to figure out treatments for it, the gene therapy, to help really increase the lifespan of these children. And so, with what I went through, my hope is that it wasn't in vain. Like, it was real. It happened. And then now let's make the changes in medicine so that it's easier for other families. Because when you are a family physician or a pediatrician, there's certain conditions that I don't even necessarily say that they're rare, but like there's children who have severe feeding challenges, and we might not know what to do with them, but we should. Or children with FPIES, for protein-induced enterocolitis syndrome, or these more severe non-IgE media allergies. Like when my daughter first had it, and I tried to discuss that with other physicians, they were like, "Well, initially, what is this?" Because I think now there's much more knowledge, but when this happened years and years ago, it wasn't that much at the forefront of what we were learning about in medicine, and so we need to become more educated as doctors ourselves. But I like the idea of writing books, because when you're writing books, you can write much more than you can talk to somebody about during a short medical visit.
Well, it just becomes that resource that multiplies your impact. So being able to take
It can
that.
have more of an impact than people who
Mhm.
can't otherwise afford medical care.
It's amazing. So if you were talking to a physician who is newly out of training or earlier in their career and trying to figure out, how do I really make an impact in medicine for the future, for my patients? Everyone's journey will look different, but what kind of mindset or approaches to life, intentionality, priorities, how would you encourage them to think about, okay, where do they need to broaden their perspective a little bit?
I think that because we're talking about physicians here, we are so privileged, right? We are so privileged that we get to learn so much about the human body. We have our patients who share things with us that they might not share with anybody else. And because they want our help and they want our guidance. So there's incredible privilege in being able to have that kind of an impact on others. And then with that comes incredible responsibility. And that responsibility includes believing them and understanding them and having empathy towards them. And sometimes saying, you know what, I don't have the answers, but let me see how I can get the answers for you. And that might be sending them to a specialist. It might be sending them to an article. It might be sending them to somewhere where there's a support group, because sometimes depending upon what you're dealing with, if you're dealing with a family that you're the physician for, and they have a condition that is not that common, sometimes one of the best places you can get information, some of your information, I still have to rely on the physicians because sometimes the information in these support groups is not the most necessarily medically accurate. But one of the good places you can get information is in support groups. Find the support groups, go in there, talk amongst yourselves, talk about families, and encourage that. I think that what's really cool about medicine is it's such an integral part of all of our lives. No matter what specialty you go into, you're always going to be. Health is important for everybody. It's like music. Like everybody listens to music, and it doesn't matter what language you speak, you're going to have a similar music experience. With health, it doesn't matter what else you do. We all value health, and we all can have conversations about it, and we can all find commonality in our shared health experiences.
It's a great word, that common humanity, and just saying there'll be different expressions, whether it's different family background, different cultural background, but it's like, yeah, we want our kids, our family members to do well and to be healthy. And so how can we, come alongside and support them? It's really just a good reminder in the midst of sometimes the busyness of medical practice to say, how can we leverage those relationships, those support groups, those other community resources to say, you are a whole person. These are the real experiences you're having. But we are still learning. And if we embrace that, I think it encourages families to say, oh, I can bring up that other symptom because they're actually going to listen to me.
Listen, and they're going to try to understand, and they're going to have empathy towards it. And I think we have to approach others with love.
Well, thanks so much for joining me here on the MedEdWell podcast. If there's a physician or a parent that might be listening today and wants to find out more about you, your work, how they might be able to work with you, or that you might be able to help them with your book or otherwise books, where can they find out more?
Oh gosh. So I just revamped my website, evkamd.com. I'm on Instagram as EvkaMD. I have a podcast, The Dr. Evka Show. I do see patients in New Jersey. So I'm back to seeing patients more regularly. My daughter's doing just fine. Journey, but better, so much better. And now I'm at a place where I want to give back, not just through books, but also through courses and through actual seeing patients. The best place to get all this information, Amazon, Evka Cesnek, MD, and just go to evkamd.com. And from there, there's links to everything.
Well, I'll make sure those are in the show notes, but I just wanted to thank you for your time and your generosity sharing your story. And I hope this has been inspiring to those listening. And I want to encourage all of you to subscribe to this podcast and share this episode with another doctor in your life. You may just be a part of encouraging and supporting someone in a really challenging season of life. And I'm so thankful to be able to foster some of these conversations and provide these opportunities to other physicians like you. Thanks so much for all you do to care for others. I look forward to having you join me on the next episode, and have a great day. And now for our important disclaimer. Dr. Ryan Stedjink is a practicing general pediatrician, but the MedEd Well podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEd Well podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEd Well podcast, and have a great day.